First thing we're going to do is kind of just go over what we have on the board. Going to just go through different structures here. So we have our spine, and then this is going to be the cervical spine up here, the neck area. And then we have our thoracic spine, and then we're going to go into our lumbar spine here, and then we have down here our tailbone or coccyx, and then this here is going to be the pelvis, and then this is going to be our femur, the bone that goes from the hip to the knee. And then down here we got like our kneecap, and the red is going to represent our musculature. So we have on the front side, this is the front of the body, like our core muscles and our belly. And then we have on this running parallel, that's also going to be like our side abs. That's what that represents. And then we have in the back like our erectors, the muscles that help us stand nice and upright. And we want to have a good amount of distribution in tension from these muscles. Then on the front lower half, this is going to be like our quadriceps or our front part of our thighs. And then we have on the back side the hamstrings. And right in here, if you can see, this red line runs from like the side part of the pelvis down to the femur. That's going to be like the side part of our butt. And in an ideal position would be to have these muscles cooperating with each other, where they allow each other to kind of pull and elongate as needed. What happens is a lot of times we end up with like a muscular imbalance, and the muscles end up pulling too much one direction, and then the pelvis will start to rotate one direction, and then that's going to cause different issues with the spine. So we'll start with the most common one that I seem to come across. Is going to be our anterior pelvic tilt, and this is where like the pelvis starts to rotate forward. And some of the things that come along with that are going to be overactive muscles in the front, and they're pulling the pelvis down. So they end up causing us to have this little shift downwards. Let's slide this back here, and what that does at the pelvis is it causes like this forward motion, and then we end up with like a big arch in the back. And if you look at these muscles here, the ones that are not doing as much work in this case are going to be your belly muscles, the abs. They're not pulling the pelvis upwards. And then we have the hamstring muscles are also not doing as much work in the back side. So they're not pulling the pelvis down. So hamstring and glutes a lot of times are going to be a little underactive in that position. And what we want to do is kind of just go through a process of getting the muscles that are not doing as much work to work a little bit more, and then to get the muscles that are a little bit tight or overactive to relax and to kind of stretch those out a little bit. So that is the anterior pelvic tilt. And we'll go through a couple exercises in just a minute to kind of address those. And then another one that we see a lot is the posterior pelvic tilt. Not as common, but definitely happens quite often. So if you see people who they look like they don't have a butt, like they're kind of tucked underneath here, and it's just like all straight down. A lot of times they're like really tight through their glutes and their hamstrings, and it's going to pull their pelvis straight down. And then what that does is going to make this part of the back really flat, and it just is going to be really straight in there, and that could cause some like back pain and tension. And what we're looking at with that, a lot of times the belly is kind of in a pinch position. It's overactive and it's tight, and then the hamstrings a lot of times in the butt, the backside, are going to be pulling really tight as well. And what we want to do is get that to relax a little bit in the belly, and then get the hamstrings and glutes to relax a little bit so we can foam roll or stretch those. And then we want to go ahead and get the low back musculature to work a little bit more. So like this squiggly line, if you can see, that represents like a muscle that's not holding as much tension, and we want to get that to just activate a little bit more. And then the front side here, the hip flexor complex, it needs to just be more engaged. So we want to just get that a little bit more fired up, and that will help kind of balance this out. So one thing I would say about all of this stuff is, like, if you are always in a position where like this posture is happening, it's hard to do it with just exercise alone. If you just do the exercises, it will help while you're doing the exercises, but then you go back to sitting at your desk and you're slouching and your butt is tucked underneath and you're kind of in like this posture while you're sitting, and all this is getting pulled underneath, and it's going to still exist in your daily environment. So you want to try to get to the root cause of that, but the exercises will help you identify those areas to like squeeze and the areas that you need to like lengthen, but you really want to make sure that you can get to like what the issue is as far as like your movement mechanics outside of your exercise is doing to you. And then we'll go ahead into a third posture that we see. That's going to be sway back, and that's a little less common. Definitely, I mean, you see a fair amount of it. You might notice people that are standing and like they're like here, and then it takes this weird shape through their spine where it kind of just makes them bend a little bit more in different places. And then really what happens with that is the hips are shifted forward, and they're really far forward, and the muscles in the backside a lot of times, and in particular like the low back and the butt and hamstrings, are pulling a lot. They're creating a lot of tension. And then on the front side, like the hip flexor complex, the front of the thighs, like this area is not pulling back. So that literally like the pelvis is shifted forward. You see the arrows kind of showing you that it's pushed forward. Doesn't necessarily mean that the pelvis is going to be tipped forward or backwards, but it certainly is not in alignment, and it's going to put havoc and tension on the spine. So we want to think about our pelvic position relative to the spine, and how we hold that is going to be a big part of keeping our back healthy, keeping ourselves in a good position. And then we'll go into lateral hip hike, and this is pretty common. Definitely see this quite often, where people kind of shift when they're squatting, or even just in general when they're standing. Like they could be in like a position where they're standing and they kind of just lean on one hip, and that hip that they're leaning on is going to kind of be down, and then this hip over here, it kind of pulls up because this musculature is kind of pulling down here, and then this side is going to be kind of out and up. And when we look at posture here, what that does is it shortens out the muscles. So this pelvis is a little bit higher on this side. The muscles on this side are going to be tighter, and then in the back area, and then in the hip, they're not going to be as active. On like the side part of the butt, they're not going to be pulling as much. And then when we look at the other side above the pelvis, like we're going to not have as much tension here, and then this side is going to end up taking on more tension in like the side part of the butt. And then going into like the legs, a lot of times almost always, on the same side that we have that shift or that hike, the inner thigh, the adductor complex, is going to be a little bit more engaged, and that's going to pull the pelvis in that direction. And then the opposite side, it's not going to hold as much tension. So we want to just get that back to neutral. And we'll go through some exercises here where we can kind of address some of these positions and how we can kind of do a little self-care. But remember, it is also about your environment, so being mindful of how you hold yourself is definitely a big part of this. So we're going to go back to that anterior pelvic tilt from the beginning. So that's this one where the pelvis is forward, get that big arch in the back, and I'm not using my core as much. These muscles up here probably going to be a little bit tighter. Usually we'll use a foam roller, and then we're going to go ahead and roll those muscles out in the front side. And what we do when we foam roll is we're just looking through the whole muscle. We're going to try to get to the most tender spot. Once we find that tender spot, we'll go ahead and relax. Try to breathe through that, and then we're just going to work a little bit of range of motion. And we're trying to activate now on this side of the joint, the butt, and the hamstring as we try to loosen up that hip flexor in the front of the thigh. And then once we go through rolling there, we can roll through the low back. Since that musculature a lot of time gets tight, we'll kind of just support the head with the hands, see if we find anything tender, and then we'll just hang out here and breathe. Try to get that to relax as best we can. But once you get that to relax, what we can do is go into a couple stretches. So the first one we'll do is like a hip flexor stretch to stretch the front of the thigh. You can put your foot up onto the wall, and then you just bring your hands up nice and tall overhead, and then just trying to squeeze the butt and pulling up from the pelvic floor and holding that position. Get that to relax. Once that relaxes some for you, we'll go ahead into a stretch for the lats. And then I really like this stretch for the lats. You can put your hands on the wall. Pinky side is going to be on the wall. Thumbs are going to be pulled back. And then you're just going to reach your hips straight back and try to keep a nice long spine here. So you're going to try to keep your core engaged, and then we're going to get a nice stretch down the side part of the back running into the back, so that stretches all this, stretches down into like the middle of the back from there. And getting those two stretched out is really, really helpful. And then we're going to go into like diaphragmatic breathing to get the core going, and then we'll do some bridges here and some dead bugs. So what I like to do for diaphragmatic breathing is just simply lay here, and then I like to put my hands right underneath my ribs, and then I'm going to just breathe in my nose, and then pushing the air out my mouth and trying to like squeeze as I do that. Big inhale in the nose, and just trying to get that breathing going so you can feel the musculature in your core working as you're breathing there. And you can do that for a good minute just to get that turned on, get that activated. And then the next thing we'll do is we'll do a glute bridge. So we're going to try to squeeze in the butt and the hamstrings. First thing I like to think about is getting the breathing going, and then try to tuck down at the low back by kind of just drawing your belly button back, just squeezing up from your pelvic floor so you engage through the core while you're breathing. And then we're just going to lift up, squeezing in the butt, and working through the glutes here, and a little bit through the hamstring. Remember, we have a little underactivity in the glutes and the hamstring, but we want to get that stuff working. And going through about like 2 sets of 15. A lot of times we get those activated. And then you can go into dead bug, or just like a marching exercise if a dead bug is too hard. And what we could do is lay on our back, go with our hands out in front, and then we can extend out, touching the floor. And I'm going to try to keep my low back nice and flush to the floor here, working my low abs. big exhale as I reach. If that's too tough, we can just reach down, touch the leg, and go where you're comfortable. We don't want to pick up any stress in the low back here. We want to get all this tension in the belly. And then you can go for about 10 repetitions per side and do that twice. And that a lot of times we get our abs really engaged. Doing the glute bridges gets the butt and the hamstring really engaged. And then that's like a quick fix for like the anterior pelvic tilt. So there are other things that you can do for it. Definitely other things that come into play, but there are a couple simple things that you can do to kind of help balance that out. And then going into the posterior tilt, that's where we're tucked underneath again. This is basically the opposite. So like the butt and the hamstrings, they're tighter, and then hip flexors a lot of times are not as active there, not as engaged. So what we'll do is kind of just roll through back of the leg, roll on through the hamstring, see if you find anything tender there. Find something tender. You can work through a little range of motion and bend the knee and extend it. And then you can also do some spanning, kind of going side to side and rolling the leg across that in like a rotational aspect. And then we'll also go ahead up into the side part of the glute. So we can roll through here. We'll sit on just one hip here, trying to get a little rotation over. You put your same side arm down on the ground, and then we're going to make sure that we get the ankle on top of the knee. And then we're just going to work through this area. We'll get that to relax just by rolling, putting some pressure on it, and then trying to breathe through this. And getting that to relax so we can start to go through a little bit of range of motion. Open up the hips some. And then we'll do about like 6 or 8 of these, just working that range of motion. Get that to relax and ease up. And then I like to stretch through the belly. It's kind of tough to like really roll the abs. I mean, you can massage it with your hands. You can use other ways to do that, but like to get on a foam roller, I don't really recommend doing that. But what we can do is we can stretch. You can go up as high as you can comfortably, stretching through the front of the belly here. You can even go up a little higher if you're comfortable with that. We want to make sure that we keep our hips down on the ground, and we want to keep our shoulders down while we're in this position. And then usually 45 seconds to a minute holding that, get it to relax. It could take longer, it could be a little shorter, but if you're like really stuck in that position, it'll probably be on the longer side. And then again, we'll go into that diaphragmatic breathing. We'll hang out there for a minute. Just focus on the breath, getting that expansion, collapse through there. And then we're going to want to activate the hip flexors. So there's several ways we can do that. One of the easiest ways to do this for starting out is really just to go ahead and give yourself like a little resistance. And you can drop this leg down, and then you're going to try to drive into your hands, and you're not going to let that leg really move. You're just trying to create as much tension as you can with your mind to that muscle, and really squeezing up as you're in that position. Really driving into your hand, and then you can switch sides, and then drive into your hand. And I like to do like short sets, maybe 15 seconds. You do like 3 sets there. We're really trying to get that engaged. And then we want to activate through the low back. So a lot of times the low back there is a little bit flattened out, right? Because everything's tucked underneath. So we want to just go ahead through something to help us activate through there. And Supermans are an easy one to help us out with that. We're lifting through middle of the back, lifting the legs up. And try to keep our hips still on the ground. And then we'll just get a nice lift, squeezing in the lower back area, in the middle of the back, getting all that musculature to engage. And that will help us kind of balance that position out also. We'll go into our sway back posture. So this one is a little different because we have a couple different things going on. A lot of times low back's a little tight. We'll have the mid back being a little tight. Upper abs a lot of times will be a little tight because when the hips shift forward, the spine wants to kind of keep the center of mass over top of the hips. So like we end up rounding a lot. So like these muscles up here, a lot of times get a little jammed up. So I kind of treat it similar to our posterior pelvic tilt, but there are a little bit of different things going on with that. So a lot of times we'll go ahead and we'll roll through the back here, cruising through the low back, see if we get a release there, and then we'll go ahead up into the middle of the back and see if we can get some thoracic extension. We can tip here, trying to extend over top of the foam roller. You get 4 or 5 tips, and we could do this a couple places through the middle of the back. The thoracic spine is going to be basically where your ribs are, and we want to just go ahead and cruise along through there, and we'll do those tips only on where we're pressing down at the ribs. Once we go through that, definitely want to go through glutes and hamstrings on the roller, get that to loosen up some, and then we'll do our diaphragmatic breathing, and then I like to think about doing pelvic floor exercises. I think they're helpful for all of these, but pelvic floor exercise, really good to do for that posture, and we're thinking about pulling up from the bottom of the pelvis, and we're going to do this with our breathing. So on the inhale, big inhale, and we're going to squeeze in the pelvic floor, and then exhale, we're going to relax, and we'll go ahead and just work that rhythm, trying to get a good sensation, squeezing up from the bottom of our pelvis as we expand through our rib cage for that breath. And then we'll relax the pelvic floor as we exhale. And getting that in rhythm, it really helps. That is definitely the start. And then there are different ways we can address it. We did the hip flexor exercise. I also like to do like a plank with like a hip hike. You kind of push the hips up towards the ceiling. Remember, because that pelvis is shifted forward, we're going to try to pull the pelvis back with our abs, our lower abs, and the hip flexor complex in front of the thighs. So we can just go into this position. We're going to just drive back, and then we'll pull back in. Just trying to push the pelvis back with our hip flexor muscles and our low abs. And steady breathing. Again, we can go like 2 sets of 12, 2 sets of 15 if you're really able to engage that. And that's going to help us just kind of pull this tension into here, taking our posture from here to here with just the pelvic positioning. And then I like to do like maybe a band pull apart as well, or another exercise to just kind of get open through the middle of the back, get the chest open. So if we're rounded here, like getting this activity going, this is going to help us strengthen through the middle of the back, trying to be taller, and just make sure that we get a good squeeze straight across the middle of the back there. Again, like 2 sets of 15 is a good place to get that going. And again, this is like a brief overview of how you can correct these. There's definitely other things that come into play, but if you notice you have something like this, then it's good to get like an assessment and get like a lot more specific exercises to you to help you out with this, especially for this next one, because there's so many things that could be at play. We get a hip hike, there's going to be this shift. This stuff is going to be tighter on this side, and then we're going to end up with this being a little bit tighter. This isn't going to be holding as much. This might end up getting more of that squeeze. So we want to go ahead and just foam roll through same side. So if I'm shifted, my pelvis is up on this side, I'm going to want to foam roll on this oblique, and this hip, and then on this inner thigh. So what we'll do, we'll go ahead and we can hit this foam roller on the inner thigh of that same side, cruise through. You find a tender spot, you can go ahead and do a little spanning here. It's going to be just sliding that up and over, get that to relax some. Once it relaxes a bit for you, we'll go ahead and hit same side lower back, so just into that area there, kind of just putting it off to the side. And I'm just going to go on this side to show you. We're just cruising through like we did earlier. And once you get that to relax, that is going to be part of it. We can go ahead and kind of stretch through this inner thigh, open up through there, and then we want to go ahead and do something to help us activate through the opposite core and then inner thigh. So like if I'm shifted this way, I'm probably not using these abs, so I need to find a way to get those engaged. The side plank is a little bit more advanced. It's definitely one that is helpful for this, where we can lift up through here, lift in from the bottom hip and the side abs, lift in through there and hold in tension. We might go 2 sets of 20 to 30 seconds. Kind of help hold tension through there. You could go into pail off press on here, so that the band is going to be pulling me out that direction. I'm going to stand nice and square here and trying to hold tension into the midline, so I think about like trying to pull my legs inwards. That's going to help with activating this underactive inner thigh. Remember, because this one's a little bit overactive. We just rolled it, try to stretch it out. We're going to try to activate these together so they're working simultaneously. And then we'll just hold that tension, and we're going to reach straight out and then pull them back in and not letting this band twist us. So we don't want the band to pull us as we're going out here to the side. We don't want our hips to kind of go into that shift there. So we're going to work nice and steady through the core and the midline, and then just working straight out. And as we're doing that, we should feel this kind of kicking on through those side abs. And then I usually will work that like 2 to 1. So do two sets on this side, and then maybe 1 set on this side, since this side is a little bit more active. And we can get this to kind of balance out a little bit more that way. Let's see. And then we want to activate the opposite glute as well. So we're getting that shift here, and this is hiked up. Then this glute is probably not pulling down as much. And you can kind of imagine, like, if I shifted here, this isn't holding tension, this is holding more tension, this is probably holding more tension, just like thinking about how those lines pull. And so we want to activate this glute a little bit more. And we could do a lateral leg raise for this one. This is a really good exercise. Just make sure that we get this in a good position. So we're going to be pulling the toes up and make sure the hip is stacked, and then we're just going to lift the leg to the side and then lower down, squeezing just in the butt. And good control through that. And we'll do again about 2 sets of 12, 2 sets of 15, kind of activate that there. And usually I will do like a glute bridge with that. So once you already get that going, we'll go ahead and go back to this position here, and then just lifting up, trying to get an even amount of squeeze from both sides, and then we'll go for about 2 sets of 12 to 15 there. And yeah, that pretty much will help you get on the right course to balancing it out. So ways you can kind kind of find out for yourself is to film yourself when you're doing exercises or movements, or even just looking in the mirror. You can definitely see quite a bit just from your static posture. However you stand just normally. Like if you stand normally and you get this shift, or you feel like one side is higher. When you look in the mirror, you can see that like this line down the middle of your belly, you can see it kind of shifts to the side. You can start to get an idea of how that is pulling one direction versus the other. So that is a lot of the things that you can do for it. Again, it's really helpful to get an assessment and get yourself like specific exercises, and then to work on those regularly, but also working on like how you control your body with your mind outside of how you work out. The workout is only part of it. The rest of your environment is a big part of it, really.